So how do we diagnose acid reflux or Gerd? In order for us to come to the conclusion that you suffer from Gerd, we have to put everything together. Number one, the most important piece of information is the patient's history and physical. So the information that you provide to us in terms of your symptoms. Are you having burning? Are you having the sensation of the food coming up? Are you having constant sore throat? Are you having cough, nausea, vomiting, atypical chest pains? So we take all of that information from the contest and we suspect that you suffer from Gerd. With that, we move to the next step, which is the confirmation of your symptoms, the confirmation of the disease. For that, primary care doctors tend to do a trial of medications where they start treating you with pills and they watch and evaluate your response to the medications before they conclude whether you have the disease or not. As a specialist, I have to take it to the next step. I have to understand the severity of the reflux disease that you have. A primary doctor may not be able to perform this test, but I can as a specialist. So what I would do is that I will probably perform an endoscopy. An endoscopy is an objective visual evaluation of your esophagus, of your stomach, and your valve. The things that I'll be looking for is to see if you have burning from acid reflux, if you have any structural damage at the valve, if you have a hernia where the stomach is pushing up into your chest, or any other changes that are associated with reflux. There are other ways that we can visualize the esophagus and the valve. By that, I mean x-rays. We give you a contrast material to swallow. We watch it going down into the esophagus and into the stomach. We call that esophagram or x-ray test. If your visualization or x-rays is relatively normal, does that mean you don't have Gerd? Not necessarily. The gold standard test to diagnose whether you have acid coming up into your esophagus is what we call a pH test. A pH test means that we leave a monitor into your esophagus and we can tell how many times acid is coming up and down during the course of a day, 2 or 3, even 4-day test. So that monitor that we leave into your esophagus will tell us how much acid is coming up, but you also tell us what are the symptoms that you are feeling during the course of the test. We put both information together, the symptoms that you're feeling plus what the monitor is telling us, and this is the gold standard test to know whether you have reflux or not. This is called a pH test. There's also another test that we perform, is called Cosophogenometry. The Cosophogenometry, the word manometry means pressure. We put a special catheter from the nose into your esophagus and down into the valve. That catheter will tell us the swallowing function of the esophagus, how well the food is being pushed down, but it will also tell us how well the valve is functioning, whether the valve is weak, whether the valve is too strong, whether the valve is opening when it's not supposed to. So when we have all of that information is that we can come to a treatment plan that will be suited to the individual patient.